Hi, it's Dr. Sarah Moore here. Welcome back to the third video in my pregnancy series. Today I'm going to be talking about the second trimester. And in this video, I'll outline how we can manage symptoms in the second trimester. I'll talk about the testing that your pregnancy care provider will offer you. I'll also talk about booking into the hospital where you intend to birth and focusing on continuing your self-care practice in the second trimester. So, when we're talking about symptom management, we do notice typically that symptoms do tend to settle down a bit in the second trimester, but some women do continue to experience nausea and they can experience pain as well. In particular, some women notice that they get gastroesophageal reflux symptoms, and they can actually start feeling a bit short of breath as their growing belly pushes up on the diaphragm. So there is some value in making dietary choices that reduce these symptoms. It's also important to note that women do start becoming a bit iron deficient during the second trimester, and this can lead to fatigue and lethargy. So it's really important to focus on choosing dietary options that are rich in iron, and this includes obviously red meat and green leafy vegetables, and this will help minimise that deficiency and optimise your energy levels. In terms of testing, there's going to be a few tests that you will be offered in the second trimester. The first is an anatomy ultrasound, and we usually do that around 19 weeks. And this checks every part of the baby's anatomy. It also looks at where your placenta is situated, and it also measures the length of your cervix. You'll also be offered some blood tests at the end of the second trimester, and this includes checking your hemoglobin and iron studies for anemia. We look at your red blood cell antibodies, and we also do some glucose testing for gestational diabetes. If you do have a rhesus negative blood group, you'll be offered anti-D, and this prevents rhesus isoimmunization, which actually is more important for subsequent pregnancies and preventing issues there. The glucose tolerance test remains the gold standard for diabetes testing in pregnancy. If you feel that you prefer not to have this test, or that you're not going to be able to fast and drink the glucose drink because of symptoms of nausea and vomiting, then it's important to discuss alternatives such as finger prick blood sugar testing with your health practitioner. If you have any risk factors at all for diabetes, including a family history of diabetes or medications such as steroids or antipsychotics, if you've had a previous big baby, if you have an increased BMI, then I do recommend screening for GDM, because the consequences for your baby, if this diagnosis is missed, can be significant in terms of the infant's birth outcomes and their future health. So, booking into the hospital. If you're planning to birth in hospital, I do encourage women to book in where they intend to birth during the second trimester. And that allows your information to be stored at the hospital, and also allows you to familiarise yourself with the space where you'll be labouring and birthing and meet the staff that will be supporting you. You can also start antenatal education classes, and they are often offered for free by the hospital, but there's also some great online resources that you can access. In terms of your daily self-care practice, I really encourage you to continue any sort of practice that you've started in the first trimester or even preconception. And we've talked about these previously, so things like yoga, mindfulness meditation, self-hypnosis, or any other practice that you find valuable. And I think this is really important to continue practicing daily so that you really wire those neural pathways in preparation for your birth and for motherhood. Even as little as 5 minutes a day will have a positive impact on your pregnancy and birth experience, and I really do encourage you to make this a priority each day of your pregnancy. So in summary, today we've covered your management options for symptoms in the second trimester, testing that your pregnancy care provider will offer you in the second trimester, booking into the hospital where you intend to birth, and the importance of continuing a daily self-care practice. For more information on any of these, please do visit my website, drsarahmoore.com, and subscribe to my blog, This Doctor's Life, to receive more information like this every month.